visible. Okay. So it is my pleasure to welcome back Dr. Nidhi Sharma, who spoke with us last month, I believe.
Yeah, I think.
On women's pelvic health. It may have been September, end of September, beginning of October. So we're happy to have you back. And a little bit about Dr. Nidhi Sharma. She's a doctor of physical therapy, board certified orthopedic clinical specialist, and board certified women's health clinical specialist based in Mamaroneck. And we're happy to have her back to talk about women and bladder health. And it's also National Bladder Health Awareness Month. So perfect time for this talk. So hand it over.
Thank you, Giovanna.
You're welcome.
Hi, everyone. My name is Nidhi. I am going to share my screen. And where is it? Keynote. Okay. All right. My screen's visible, right?
Yes.
Hello. Okay. All right. So my name is Nidhi Sharma. I am a board certified women's health clinical specialist. I've been practicing for about 15 years and working primarily with women with pelvic issues, bladder issues, bowel issues, sexual issues, postpartum, postmenopausal. That's my specialty. I have a clinic in Mamaroneck and a clinic in Midtown Manhattan. So today we're going to talk about just a little bit of how bladder works, right? What bladder is, how it works. And then I'm going to go over some of the problems that often happen in bladder. What are the symptoms? And then we'll finish up with what can you do? Some common things that you can just do in your daily life. And then I'll present what can you do in more specific about those symptoms that are happening. All right, so here is the bladder. Bladder is basically a bag. It's like a balloon, okay? It fills up with urine, so it stretches out. And then bladder, hold on. Bladder, the lining of the bladder is actually a muscle, okay? This muscle is a smooth muscle, which means it's not in our control. It's the muscle like heart. You can't stop it. It's a muscle, it's working, but you can't stop it. You can't start it. You have no control over bladder. Voluntary. Then, so this is bladder. This is the balloon that fills up. Underneath this bladder, there is a basket of muscles called pelvic floor muscles. There's a little picture here. And these muscles basically are in your control. These are the muscles like biceps or quadriceps or your neck muscles. They are in your control. You can contract them to stop pee. You can relax them to allow pee. So this is how you're able to stop your pee. You're able to decide when you're going to pee. So what happens when your bladder is quietly filling? So you are drinking water, but you're not going to the bathroom. What's happening? Urine is continuously flowing into the bladder. Bladder is slowly expanding because it's a balloon that fills up with water. And then pelvic floor is tightly contracting to keep that pipe that goes down outside, which is called urethra, where you pee from. Pelvic floor is contracting around that pipe to close it, to keep it closed. So bladder is filling, you're not peeing. There comes a point about 3/4 full bladder, or maybe a little more, that bladder muscle gets stretched, and that stretch tells your brain that, oh, bladder is filling up, we might have to pee. So that signal goes to your brain tells the bladder we have to pee. That signal goes to your pelvic floor. Your pelvic floor starts to relax a little bit and you get the first urge. You kind of know in the back of your mind, oh, I might have to pee soon. Typically, we don't usually pee at this time. We wait another 15-20 minutes. The urge gets stronger. The bladder is filling out more. Brain goes again. We have to pee. And then you might pee at that time, or you may wait for that third urge where it's the real urge and you feel like, oh, I have to go pee right now. When you go to pee and you sit on the toilet, what do? Nothing. You have no control over what happens with bladder. You just sit and you relax your pelvic floor, basically let the pipe open, and then the bladder contracts to push the pee out. You don't really make the bladder contract. Bladder contracts like heartbeats. And I'll explain why I'm saying that you have no control over bladder, because some people think that they do. So I'm going to explain why that's relevant as we go on. So this is simply how bladder works. And these are the two players in bladder health. One is bladder muscle, bladder, and second is the pelvic floor muscle, which is underneath it, which is basically keeping it closed, keeping the pipe closed. All right, so what happens? This is the normal function of bladder. You should be peeing every 3 to 4 hours. You should be peeing 6 to 8 times a day. You should not be peeing more than twice at night unless there is a specific reason, like you take a medication at night that makes you pee. There should be a good, strong stream for 15 seconds or more. So if you sit on the toilet and then you start peeing, and when the stream becomes strong, start counting 1001, 1002. If you count, it should be at least 15 seconds. If you pee and it's not 15 seconds yet, then you peed before the bladder gave you the urge. And I'll explain why that's important. Okay, so 15 seconds of good stream is normal, average. The urge should build slowly, like we talked about. There's a first urge, you kind of forget about it. Second urge, you know. Third urge, significant. It shouldn't be like, oh, I have to pee, and then 2 minutes later, I walk into the bathroom, it's like, oh my God, I have to pee. That shouldn't be the case. And finally, when you pee, you should not feel like your bladder isn't empty. You should not feel the urge to push to empty your bladder. Your bladder should easily empty. You have no control over bladder. So when you push to empty the bladder, all you're doing is using your abs, your abdominal muscles to drive down the bladder. You're not actually making the bladder contract. And I'll explain why that's not a good idea. All right. So when things go wrong in bladder, one of these things happen. Leaking. Okay. So a little bit of pee comes out different times in the day. Second, urgency or frequency. Urgency means you need to pee frequently, which means urgently, which means, oh, you didn't have to pee and now suddenly you have to pee a lot, right? So you have to run to the bathroom. That urge does not build slowly. You don't get those signals from the brain that you have to go. Frequency is when you're peeing more than 6 to 8 times. Typically, we see frequencies if you're peeing more than 10 times at night, or if you're 10 times in the day, or more than twice at night, unless you're on specific medication. Burning discomfort, when there is a discomfort while you're peeing, either with starting or during peeing. Overactive bladder is when bladder contracts at sudden moments, doesn't really give you enough signal that it's going to contract. Okay, so you have this sudden urges that come out of nowhere. Sometimes they settle down, sometimes you have to go pee. And finally, bladder prolapse, when bladder starts to move down from its position, happens in postpartum and postmenopausal women a lot, where the bladder starts to lose its position because of weakness of pelvic floor. Pelvic floor was underneath it, remember? So pelvic floor is kind of supporting the bladder in place. So when pelvic floor gets weaker, the bladder starts to move down from its place, especially when it's full. And sometimes what we see is the bladder starts to protrude out of the vaginal opening, and that's called bladder prolapse. Okay, so I'm going to go over these one by one and explain why it's happening. What can you do about it? Leaking. So this was the first picture we saw. Remember, bladder was full, pelvic floor was closed. Now, what happens? Pelvic floor is keeping the pipes closed. What happens if this pelvic floor that keeps the pipe closed is weak? Okay, so when you cough or sneeze or jump or run, there's extra pressure on top of the bladder, and that pressure comes down. What needs to happen is that muscle that was keeping the pipe closed needs to contract, needs to get even stronger contraction to keep the pipe closed. And if it cannot do that, then the pee comes out. You might leak a couple of drops, you might leak a lot more, okay? So that's one kind of leaking, which is typically what we called stress-related leaking. Stress meaning there is physical stress on the bladder. It's coughing, sneezing, jumping, running. And main cause, usually the only cause, is weak pelvic floor. So the muscle underneath it is not able to keep the pipe closed. Second kind of leaking is urge-related leaking. This leak happens when you don't run, you don't jump, you have urge to pee. You suddenly know, I have to pee. And then you start walking to the bathroom. And by the time you get to the bathroom, your urge builds get so overwhelmingly strong that you end up leaking. So urge-related leaking happens because of two causes. One, same pelvic floor. Pelvic floor was not able to keep the pipes closed. But second, also, your bladder is contracting stronger than it should without giving you the right communication. So urge-related leaking is often due to bladder instability. The muscle of the bladder itself is not doing well, plus pelvic floor is not doing well. So urge-related leaking is often urge-related leaking, where leaking happens after an urge is often a bifold problem. When the leaking happens just with stress, coughing, sneezing, it's usually just one problem, which is weak pelvic floor. Okay. Moving on, urgency and frequency. So urgency happens. So let's say this was the bladder that was filling. This was the pelvic floor that was keeping it closed. What happens if the pelvic floor, instead of keeping the pipes closed, is squeezing the pipe? Or as the bladder starts to relax and the pee is starting to come out, pelvic floor, instead of letting go and letting the pee come out, keeps squeezing. So urgency and frequency is often a problem when pelvic floor is not able to let go. It's not able to open the pipes. So bladder is trying to pee, it's trying to push the pee out. Pee is coming down, but pelvic floor, instead of letting go completely, is kind of slowly letting go or really not letting go. And then what happens is a little bit of pee comes out. You think you're done. You get up outside. Bladder is still full, not empty. Then you go, oh my God, I have to pee again. Then you go back. Pelvic floor lets go a little bit. You pee a little bit more. Same thing, same cycle repeats over and over again. These are the people who need to pee more than 2 times a night. Their urgency increases suddenly a lot because you're not emptying the bladder. Bladder is ready to empty. Pelvic floor is not letting go. So often the cause of this urgency frequency is a tight pelvic floor. Remember, it's a muscle. Like your hamstrings can get tight, your neck muscles can get tight, pelvic floor can get tight. So pelvic floor contracts, holds the pee, but does not let go easily. So a little bit of pee comes out, it squeezes the tube, you get up, a little bit of pee comes out, and that cycle is repeated. This is often when you're peeing less than 15 seconds at a time. Remember, I said your stream should be good, strong stream for 15 seconds at least, which means if you peed for less than 15 seconds, the pelvic floor didn't completely let go. Pee was coming out, and instead of getting out of the way, it contracted again and held the pee. So you are peeing, you're not emptying your bladder. Your bladder is still full. You walk, you get up, you go, and then you get the urge again, and you have to come back. These are also often the people who feel like they have to push the pee out because your bladder is not emptying. Your bladder is telling you, I'm not empty. Your brain is telling you, your bladder is not empty. You need to empty it. But the pelvic floor is not letting go. So you have this urge that you need to really empty your bladder. These are the people who sit and they bear down to push the pee out. And what you're basically doing is you're using your abdominals to squeeze the bladder, and sometimes you're able to overwhelm that tight pelvic floor and empty your bladder. Many times you're not able to, and then you go and then you come back and the cycle was repeated. The tight pelvic floor is one cause. Infection can be the other cause, although if you have an infection in the bladder or pelvic floor or urethra, you're not going to just get urgency and frequency, you'll also get some pain and burning. The symptoms of infection are a little bit more severe. If all you have is pain less, urgency, frequency, the likelihood is tight pelvic floor. Third, overactive bladder. Now, overactive bladder is truly a bladder disease, and bladder is not really in your control. Like I said, you don't make the bladder contract, you then make the bladder relax. You don't really do anything with that. This is the kind of bladder that suddenly gives you an urge. Usually you should not leak, because if you have a healthy pelvic floor, then even if you get a strong urge, the pelvic floor will squeeze the tube, keep the tubes closed, and you won't leak, right? So overactive bladder, a true sense, will be frequent, uncomfortable urges, but no leaking. If leaking happens, then likelihood is that you have a twofold problem. You have urge incontinence. Remember, we said urge-related leaking is when the bladder is not stable and the pelvic floor is also weak. So that's how you can tell the difference between an overactive bladder and urge-related leaking. Overactive bladder, I feel like, is very overly diagnosed, because everyone who is leaking pee or going frequently just think they have overactive bladder. It's not always overactive bladder. A lot of time it's weak pelvic floor or tight pelvic floor. Sometimes it's overactive bladder along with weak or tight pelvic floor. So just pay attention to that. Usually in true overactive bladder, there is no discomfort with urination. There is no burning. There is no real frequency. There's urgency. Okay. It frequently happens along with pelvic floor dysfunction. If you have a tight pelvic floor for a long period of time, that's not letting the tubes open, that's not letting the pee come out, eventually your bladder will become overactive because it's just constantly trying to push the pee out. You're not letting it out, right? So it's constantly overworking, which makes this bladder muscle unstable. And over time, it may lead to an overactive bladder. Interstitial cystitis, this is really a clinical diagnosis. I'm going to just touch on it a little bit because this needs more individual attention. Painful bladder syndrome or bladder pain syndrome, which is basically there's pain at where the bladder is below the pelvic bone. These are the patients who have, people who have pain with filling. So your bladder is not filling comfortably. As the bladder starts to fill, you get some pelvic discomfort, you get some pain in the lower abdomen, your bladder feels like it's spasming, you have discomfort with bladder filling. Again, sometimes it's a true bladder problem. There are lesions, there are problems within the bladder muscle that needs to be resolved. And sometimes all it needs is pelvic floor physical therapy. And I'll talk about that a little bit later. But if you have IC, if you have been given the diagnosis of painful bladder, bladder pain syndrome, just know that pelvic floor is a big part of it. And the condition responds very well to pelvic floor physical therapy. And we'll talk about that, and bladder training. We'll talk about that a little bit later. Okay, so let's talk about bladder health. What should you do and what should you not do? You would be surprised to know that bladder problems originally 70% of time happen because of our behaviors. Pelvic floor gets weaker or tighter because of our behaviors. Bladder sometimes actually becomes unstable because of our behavior. So I'm going to explain some of those behaviors, and I'm going to remind you what I explained about how bladder works, and we'll try to link that here. Okay. So first, do's and don'ts. Water. Drink little, but drink often. What do I mean by that? Far too many people don't drink water all day, right? They go 6 hours, 8 hours without drinking water, and then they drink 2 or 3 glasses of water because they're so thirsty. What that does is that does not give your bladder a chance to adjust to this increasing volume, right? Slowly the water is trickling down into the bladder, pee is trickling down into the bladder is slowly filling, slowly stretching. It's a gradual process. When we suddenly stop drinking water and then we drink a lot of water, bladder suddenly fills, right? And this sudden filling is more likely to make this bladder muscle overwhelmed. And it's more likely to become unstable over time. It's not today or tomorrow, but over time, if you have this habit of just overwhelming the bladder and then dehydrating it, and then overwhelming it and then dehydrating it, it is more likely to become unstable. So what should we do? We should drink 2 to 3 sips or 3 to 4 sips of water every hour. Okay, so keep the water bottle by you. Take a few sips every hour. Don't wait for yourself to get super thirsty. You will see that if you make it a habit of drinking 2-3 sips every hour, you will never have that sudden, weird, strong urge to pee because you're not overwhelming your bladder so much. Second, don't pee just in case. So what happens? Happens especially in new moms, happens in office workers a lot. They will pee every time they cross the toilet, right? So they're walking over and it's like, oh, I'm here, might as well pee. I'm here, might as well pee, right? So that's called peeing just in case. You don't really have to pee, you don't have an urge, but there's a toilet, might as well pee. What happens that time? Remember I said the bladder fills 3/4 of its capacity before it tells the brain, oh, we have to empty. So now you're peeing just in case. Your bladder is probably half fill, maybe 1/4 fill, who knows, right? So your bladder may not be that 3/4 full. And if you pee, then over a period of time, if you keep emptying your bladder at various volumes, you're teaching your brain that, oh, we should pee at half full bladder. We should pee at 1/4 full bladder, or we should pee at whenever we want, right? Whenever we see a toilet. So you're basically training your brain and your bladder to give you urges when it's not full. So over a period of time, months, years, what happens is that your bladder starts to give you urges when it's not really that full. It becomes less and less predictable. And if you stop peeing just in case and really wait for that urge to come, you'll see that bladder will become a little more predictable in a few months. And of course, if you have to go on a long car ride, pee. But if you're just walking by the restroom, see if you can not pee. And, office workers should just not wait, should not just go to the bathroom because they're passing by the bathroom. Go back to your desk and go to the bathroom when you have to go to the bathroom. All right. Third, don't push your pee out. Again, this starts a lot in childhood. Kids have a habit of pushing their pee out because they want to be done with peeing and get on with their day. And that sometimes office workers have this habit because they want to be done with peeing and go back to that meeting. Or sometimes people are doing this because they're claustrophobic or they don't like the public restrooms, all kinds of different things. What you do when you push your pee out is you use your abdominals to squeeze your bladder, right? To basically pound down on your bladder. And if you're doing that every day, you're teaching your bladder, one, that it doesn't need to contract, right? You have other things working to push the pee out, which is your abdominals. So over a period of time, your bladder will lose its strength to push the pee out because you're not letting it do its job. And second, you are putting that extra pressure into the bladder and pelvic floor, which may lead to prolapse because this constant pressure down into the bladder is not normal, is not needed. What should you do when you go to the bathroom is nothing. You should sit and do nothing. Absolutely nothing. Okay, sit and relax. Pee should come out by itself. You should not have to do anything. Don't hold longer than 4 hours. This is, again, a thing that starts in childhood a lot. Kids hold their pee for 6-7 hours. Sometimes they don't drink water because they don't want to go to pee. This happens in office workers and people who are on the road a lot. They don't want to use public restrooms, so they just don't pee. If you're holding your bladder more capacity than 3/4, what's going to happen over a period of time, your bladder will just keep getting stretched more and more and more, and it will lose its contractility. It will lose. So remember, a spring, you stretch it and then it comes back. You stretch it, it comes back. What if you keep stretching that spring over a period of time and overstretching it and never let it come back, it will lose its strength to come back. So a bladder that is overworked for a long period of time often loses its strength. So then it's not able to push your pee out even if you want it to. Don't ignore the strong urge. You're teaching your bladder to give you urge even stronger. Oh, I'm not gonna go at this urge. So next time your brain's like, oh, to make her go to the bathroom, I have to give her much stronger urge. So your body makes that urge stronger over a period of time. Don't hover over toilet. That's another habit of people who are on the road a lot, who have to use public restrooms a lot, office workers, kids, is that they don't quite sit on the toilet. They'll just kind of do a little squat, or they lean over and they'll kind of like hang on the top of the toilet to pee. When you're holding that position, your pelvic floor is not relaxing. Your pelvic floor the way your pelvic floor relaxes is when you completely relax. When you completely relax, you sit and relax, your pelvic floor lets go and you can pee and opens the tube. When you're kind of doing a little squat or little funky positions, your pelvic floor isn't completely relaxing because it's holding that position. And because it's not completely relaxing, it's not opening that tube. When it's not opening that tube, you're teaching your pelvic floor to not let go completely, which in long term will lead to urgency and frequency, that you will start to go a lot more frequently. You will not pee the full 15 seconds. You may not empty the bladder all the way, again, because the tube didn't open. So bring a toilet cover, keep a little toilet cover like a toilet seat cover in your purse if you need to, or bring wipes that you can use to clean the toilet. But for most part, try to sit down on the toilet and relax. Do not hover, do not squat, do not do funky positions. All right. Bladder health do's and don'ts. Stress and anxiety. Remember, I said bladder is neurologically connected to your brain. You have no control over it. It's not a muscle like bicep. So when your mind is anxious, your bladder is anxious. And we see this a lot. Is if you're really, really anxious, remember last time you were really anxious or you were really scared, you would want to do one of two things. You would either want to pee or poop, because your bladder and bowel are related to stress and anxiety. When you think, when there is a lion chasing me, what do? I pee, because my body is like, I have to save my life right now. I don't want to carry this extra weight of pee. So let me just pee, get the pee out, and then I'll run. So this primal brain, where the stress and anxiety will put us into a state of sympathetic nervous system drive, which basically means if you're anxious, you will pee. Your bladder will want to empty. So if you're constantly anxious about leaking, these are the people who are constantly thinking, oh my God, I might leak. You will leak because you are so anxious about leaking. And slowly you have to change that anxiety behavior. It may be stress from some other life things like, work or home or kids. Whatever is making you anxious is going to make your bladder unstable. Again, when you start to change the anxiety behavior, it will take a long time, weeks, months, for that to reflect into your bladder health. Okay, manage constipation. So constipation is a big one. If you are constipated and you're bearing down to poop because your poop is too hard, or because you haven't gone for 2-3 days, so now your poop is dried up. If you're bearing down to poop, you're bearing down in the back, right, to pass the bowel. You're also bearing down in the front. The pelvic floor is in the back, is in the front. So rectum, bladder, vagina in the middle. So pelvic floor controls all three openings: your anal opening, your vaginal opening, and your urethral opening. It contracts and closes all the openings, and relaxes and opens all the openings. So if you're constipated and you're constantly bearing down to push the poop out, you are constantly bearing down into the bladder as well. You will always see next time you bear down to poop, you will notice that pee will also come out. You will also pee. That's because you are also pushing down into the bladder. And you are teaching your bladder, one, that it doesn't need to contract. You're going to pee by pushing into it. And two, constant pushing into the bladder can lead to prolapse, can lead to unstable and unhappy bladder, can lead to weak pelvic floor muscles. So constipation is the root of a lot of pelvic health problems that I talked about in last lecture also. If you can do one thing for good bladder health, good vaginal health, and good bowel health, it's to manage constipation. Manage weight. If you have extra weight on your body, you have extra weight in your bladder. If you have extra weight in your bladder, you have extra weight in your pelvic floor, which means your pelvic floor needs to work extra, right? So weight, especially in the midsection, that's extra growing, is going to cause difficulty holding pee and also more chances of bladder prolapse where the bladder moves down. Very tight clothes. So very tight clothes, especially these days, they have like very high waist jeans. When there's constant pressure on your pelvic region, right on top of your bladder, the bladder is a balloon. Remember, I said it's a balloon, it fills up and then empties and fills up and then empties. So it needs space to do this all day. Every 3 hours, it fills up, 3-4 hours, it empties, 3-4 hours, it empties. If you're wearing clothes that are super tight, you're restricting the ability of the bladder to fill. So what will happen? It'll fill halfway. It can't fill anymore. So you're gonna pee because it can't fill anymore. But over a period of time, you will just lose that ability for the bladder. That bladder will just lose the flexibility to get to that full size. Okay, so tight clothes are a big problem, especially for overactive bladder people. Tight pants or dresses, really. Posture and muscles. So slouching, if you're sitting slouched all day at your desk, it makes it hard for your pelvic floor muscles to contract. Pelvic floor muscles are like your biceps or like your back muscles. Okay, if you sit slouched in a bad posture, they can't work. If they can't work over a period of time, they get weaker. They can't keep the tube closed, more chances of leaking. Tight abdominals, because you're slouching all day, so your abs in the front become tight. Again, this is the bladder in the front. This is the abdominals in the front, your six-pack muscle. The bladder is right behind it. Bladder needs to fill, and you need to have good flexibility in your abdominals. And if the abdominals are tight, if you had a surgery, or if you have really tight abdominals because you're doing a lot of sit-ups, it will take away that ability of the bladder to fill. Scars and surgeries, anything that's in the front that's restricting the ability, it will restrict the ability of the bladder to expand. It will cause bladder function to be poor. Poor sleep. There have been studies that have suggested that people who don't sleep well usually have more bladder problems. We don't quite understand why that is. I think that the link is through stress. If you're not sleeping well, you're probably more stressed, more anxiety, more bad bladder problems. So sleep is a very important part of bladder health. People who sleep better do have longer lasting bladder capacity. All right, bladder irritants. So these are the foods and drinks that irritate your bladder lining. Now, this is a big list. Not everything is in this list is applicable to everyone. So you will see that if you're having urgency, frequency symptoms, if you feel like you have to pee all the time, if you feel like your bladder doesn't fill comfortably, then look at this list. Take a picture of it or it'll be recorded. Look at this list and start taking out one food at a time, okay? Most people are not intolerant to all of the foods. They are intolerant to 3 or 4 of them, okay? For me, it's caffeine and sugar. If I eat sugar, artificial sweeteners like a cake or something, I will pee a lot more. Okay, I don't have any symptoms, but I'll pee a lot more. If I'm peeing a lot more, like you pee a lot more after coffee, you pee a lot more after having beer, that is irritation to your bladder. If you're drinking beer every night, you are irritating your bladder every night. If you're drinking caffeine every day, every morning, you are irritating your bladder every morning. Just so limit how much coffee you're drinking every day. Limit how much alcohol you're drinking every day. Limit how much sugar you're consuming, especially artificial, saccharine, aspartame, all these Splenda, sweet and low, that kind of thing. Citrus foods are bladder irritants. Spicy foods are bladder irritants. Tomato, for some people, tomato is big. They'll have a pizza and they'll pee next day, or they'll have trouble with filling their bladder. For others, it's not so much. Apple juice, and then some fruits. Again, it's nothing applies to everyone, but you should go through this list and see what applies to you. Take one out for 2 weeks and see what happens. Take one out for 2 weeks and see what happens. Caffeine, alcohol, and sugar, almost everyone is somewhat sensitive. You probably already know if you drink coffee, you go pee a lot more. Okay, bladder training. So now let's see, you have, because of whatever life habits, you have made your bladder unstable. It's overactive. It's giving you urge at certain times. It's not filling comfortably. You have sudden urges. You have leaks. Bladder is not voluntary. It's not under your control, but it is trainable. It is absolutely trainable. So bladder training is a program where we put people, we have you write down. So let me see a bladder diary. There it is. Okay, so have you write down exactly how much water you were drinking, when did you pee, if you leaked, and what was your urge. And we write down all of this. And then slowly, so let's say you're peeing at 3 times in an hour, right? Or 3 times in 2 hours, and that's a lot. We'll let you pee 3 times in 2 hours, and then we'll make this whole chart. And every few days, we will spread apart those, how much you pee by 15, 20 minutes, or sometimes by just 5 minutes, depending on what you can tolerate. So we'll slowly start to separate or lengthen the time. Now, the way it works better than you just not going to pee is because there is a system to it. We're doing it throughout the day and night. So we're constantly telling your bladder, oh, we're going to wait 10 more minutes. Oh, we're going to wait 10 more minutes. And we keep it very consistent. Okay, we're going to increase that time between the 2 pees. Let's say you pee at 11, then you pee at 11:20. I'm going to say, okay, you're going to pee at 11, and then you're going to pee at 11:25. And that's 25 minutes, and then another 25 minutes, another 25 minutes, and then 3 days later, we'll make it 30 minutes. And that's just an example. Everyone's different. But because we keep it very consistent, we teach your bladder and your brain to start to expand that capacity and not give you the urge. One of the things that most people have a very hard problem understanding is, if I have an urge, I'm going to pee. That is not true. If you have an urge, you're not always going to pee. Some of the times that people leak is when they have a very strong urge and they run to the bathroom. I tell them, when you have a very strong urge, don't run to the bathroom. Stop, breathe, take 5 deep breaths and see what happens. Very often your urge will go down. Okay, because as soon as you run, your bladder is like, oh my God, there's a tiger behind me. We have to pee. So your bladder will start contracting. And if you stop and say, oh, no, there's no tiger behind me. Let me just stop and breathe. Your bladder is like, oh, okay, we're cool. You will get that urge again, but the urge will slow down a little bit. Okay, so that's bladder training. It takes 4 to 8 weeks to work. We're basically teaching your bladder to fill more predictably, to empty more predictably. We will control how much water you drink. We will not decrease the amount of water overall, but we will decide when you will drink and how much. So basically, how much is going in, how much is coming out, and when. We're controlling all of that, and bladder usually does respond to it. And when we do this in physical therapy, it's super successful. It is a little painful to, not painful, like, just a lot of work to do in the beginning. And you must avoid bladder irritants while you're training the bladder, because if you're constantly irritating the muscle of the bladder by eating something that it doesn't like, it's going to keep contracting. So if you're in bladder training, I might ask you to just give up coffee for a few weeks. Okay, so this is what we do in pelvic floor physical therapy. Pelvic floor physical therapy is basically addressing that muscle I talked about, right? Bladder and pelvic floor are partners. They work together. When the bladder relaxes, pelvic floor contracts. When the bladder starts contracting, pelvic floor relaxes. When there's a problem in one, there's a problem in the other. When the bladder is unpredictable, pelvic floor will become tight. When the pelvic floor is tight or weak, the bladder will over time become more and more unpredictable, because they are talking to each other. If one of them stops talking or doesn't talk properly, the other one will eventually be affected. Okay, so what we do in pelvic floor physical therapy is we need your pelvic floor to be strong, that it can create a good contraction, but we also need it to be flexible. We also want it to let the tube open, and we want it to be able to close the tube, and we want it to be able to close the tube under constant pressure when you run or sneeze or cough, right? So, and with pelvic floor physical therapy, internal work is performed vaginally to stretch these muscles so that they let go of the tube, okay, especially for urgency and frequency symptoms. Then we strengthen this muscle so it can close the tube effectively, efficiently. And you probably know those exercises are called Kegels, okay? Strengthening exercises are performed, stretching exercises are performed. Some work is done internally, some work is done externally. We hook you up to a computer. Where is it? We hook you up to a computer. So there's a little sensor that goes inside the vagina. We hook it up to the computer. When you do a pelvic floor contraction, you can see it on the screen. Because you can't see the pelvic floor muscles, it's often very hard to know where exactly is it, what am I doing, right? So this here, you can see the graph. When you contract the pelvic floor, you see it going up. When you relax, you see it going down. So that's a good little tool. The other tool, if you don't want internal work, which sometimes happens, some patients don't want internal work, we can do it from the top. So this is the ultrasound I'll do. I'll put the ultrasound head on the belly, just like you do it for pregnant women. And you can see this big black bag is the bladder. This white tissue underneath is the pelvic floor. So it's very similar to the picture we saw, right? This is the bladder, this is the pelvic floor. When you contract the pelvic floor, you see this moving up. When you relax, you see this moving down. So this movement you can see very similar to the picture. So we can do this. And this is all to make the muscle stronger and also to give the muscle enough flexibility. We can do electrical stimulation to make your muscle stronger if your own contraction is not doing enough. And then I'll give you some homework to do at home to make sure these muscles are contracting properly. We also work manual therapy directly over the bladder to make sure the bladder has good flexibility. Remember I said, if you have tight clothes, if your pelvis is misaligned, if your abdominals are tight, if your hips are tight, all of those things are going to affect the bladder's ability to expand. So I can change what bladder neurologically does, but I can give enough space through the abdominals, through the hip, through the pelvis. I just work on those tissue to give bladder enough space for it to expand. Okay, so we don't change the bladder, but we change tissue around it. So if the bladder doesn't have enough space to expand, now it does. Okay, so now let's do a Kegel. Why not, right? So everyone who is leaking has been told at some point in their life that they need to do a Kegel. They need to strengthen their pelvic floor. And most of the time when I ask women to do Kegel, they squeeze. They squeeze their vagina, sometimes they squeeze their buttocks, sometimes they squeeze their abdominal, sometimes they hold their breath. So when you do a pelvic floor contraction, a Kegel, what happens, remember that muscle is like this, the bladder is here. When the muscle contracts, it pulls in like this. It's like a basket. It pulls in, but it also lifts up. So it goes down and relax, up and contract, down and relax, up and contract. So down and relax, when you say up and contract, it's not just a squeeze, it's actually also a lift. It's actually more of a lift than it is a squeeze. So if you're going to do a Kegel, instead of squeezing, I'd like you to think that there's a tampon inside your vagina, which is falling out. And I want you to pull the tampon back in. So that pulling motion, you'll feel like there's like a sucking motion. That is what the Kegel is. And if you feel like you can't quite do it, then your pelvic floor is likely very weak or weak. Okay. Some other cues are pick up a blueberry from your vagina. Again, picking up is the motion we are focusing on. Suck or sip from your vagina. So, but from vagina. Or ride up an elevator. Imagine there's an elevator in your pelvis, which is going up. So that going up motion often makes the pelvic floor go up. I like the tampon and blueberry cue because it's just very simple to imagine. But if you're leaking and you start doing Kegels, just know that it's not for everyone. Remember, we talked about urge-related incontinence. Urge-related leaking are the people where pelvic floor is too tight. Okay, so a Kegel works for people who only leak when they cough, sneeze, run, right? They don't leak any other time. They don't leak with a strong urge to pee. If you leak with a strong urge to pee, the likelihood is that your pelvic floor needs flexibility and strength. So if you start doing a Kegel right now, it might actually make your symptoms worse. So it can make urgency and frequency worse. That's why I don't teach it in these kinds of webinars, because I don't know what's going on. But if you're only leaking with coughing, sneezing, running, impact things, then you can probably try it. If you have urgency, frequency, then I would not recommend it to start with. Okay. I think that's it. So yeah, we have some time for questions. This is my contact information. Feel free to email me. This is my clinic phone number, and we take Medicare.
There are a few questions.
Yeah.
Oh, sorry.
Okay.
Go ahead. Sorry.
All right. So if someone has more than normal frequency, would those be large or small quantities? What about less frequent? I don't understand. If somebody has more than normal frequency, would those be large or small quantities? Usually be small quantities. Like if you're peeing more than every 3-4 hours, once your stream is pretty strong, I want you to start counting. And if it's less than 15 seconds, then you're likely you're peeing just in case, and your bladder is not filling to its capacity. What about less frequent urination, 3 to 5 times a day? You're either not drinking enough water or you're overstretching the bladder. There is a small percentage of people who have extra large bladders. You may be one of them, but 90 out of 100 times when somebody tells me less frequent urination, it's because they're not drinking enough water. Is it the acid of the foods that are the irritants? Yes. For some people, that's what it is. Is stevia a problem as a sugar substitute? Yes. All artificial sweeteners. Again, I want to know that not all those irritants are a problem for everyone. So if you have a problem and you like stevia, I want you to give up stevia for 2 weeks and see what happens. If nothing changes, then likely it's not relevant for you. Is cranberry helpful for bladder? So cranberry juice, I don't know if it was in that list, but it's actually also a bladder irritant. Okay, cranberry juice has been said to help the bladder infection, and that's because it makes the environment of the bladder acidic, in which it is theorized that microbes cannot live. Okay, so it creates an environment that is sort of hostile for the microbes to live, but it is hostile. It's also hostile for your bladder. So Cranberry juice for long duration is not helpful. Usually it's only helpful if you're having frequent infections and you're trying to prevent them. By itself, drinking cranberry juice actually is an irritant. Not for everyone, again, like anything, but yes, it is a known irritant, at least for some people. What causes weak stream? 90 out of 100 times weak stream is because the pelvic floor is too tight and it's not letting go. It's not letting the tube open. Okay, so that's the usual one. Some people also might have weak stream because their bladder is losing the strength to contract. So that can happen. But that's not the most common reason. So it could be bladder, it could be pelvic floor. You're very welcome.
So it says, very informative talk. Info was presented in an easy to follow way. So thank you so much.
You're welcome.
Any other questions for Dr. Sharma? Here's your chance. Okay. Oh, one more.
Is a dehydration of pees less than 15 seconds? So if you're peeing less than 15 seconds, and you haven't peed for 3 hours, right? So if you haven't peed for 3 hours and then you go and you still only pee 15 seconds, it's likely dehydration. Your bladder didn't even fill, right? But if you're peeing less than 15 seconds in 2 hours or in 1 hour, then you didn't need to pee. Your bladder wasn't full, right? So every 3 to 4 hours, if it's that way, then yes, you're dehydrated.
Very good then. Thank you again to Dr. Nidhi Sharma and for joining us tonight, everybody. We hope you enjoyed the program in honor of National Bladder Health Awareness Month. Who knew? But these obviously are topics that are important all throughout the year. It just so happens that November is a month dedicated to bladder health.